Hi, everyone. I hope you've been having a good week. This is Linda Labrise, the adjunct faculty member for psychiatric mental health nursing. And we're going to go through chapter 5 today. And that will be on the adaptation to stress. So, everybody has stress, and we've all experienced it. And get that slide up here. So it's everybody has a different way of responding to stress, and we have internal and external resources that can help us cope. And over the years, as we develop those coping mechanisms. But we do have an internal stress and an external stress. An internal stress might be the lack of sleep for several days, that you've been going to school, working, you've only gotten 4 hours of sleep every night. That produces stress after a few days. There's unresolved conflict at work or with your partner, spouse, and you're worrying about it and you're not sleeping and you're wanting to get this resolved, and that is a stressor. Now, there are external stresses too, and one could be the fires here in California have been raging, and if it's close to your home, that's definitely a stress. And another way to look at an external stress is that you're going to take a test and you feel unprepared, so you begin to have signs of having stress. So, trying to get these up here. So the different types of stress, as defined in the research, distress is damaging to the person emotionally or physically. Eustress, E-U-S-T-R-E-S-S, results in the way you feel, but the result is a positive result. And it could be something like the birth of a baby, or having plans for a wedding and you're going through all the planning, which can be very stressful, but the end result is great. And another way would be mastering a new skill. And I think as nurses, we've all gone through the part about giving an injection the first time, and you wonder if that's ever going to be okay, and you're able to do it, and finally you do, and you feel pretty good. So there are different triggers that each individual has for their own stress level. Sometimes you can take a lot of stress, sometimes you cannot. And it depends on what those triggers are for you. And there is a list in your book about the different kinds of stress, and with each of the stress, there's a point, and of course, if you have a lot of points, a high number, there is that possibility or probability that you also have some sort of physical complaint or condition. So keep this in mind when you're thinking about your patients, and you probably can then, if they have high kinds of triggers for stress, and according to that list, then you should go and look in the chart and see if they have a medical condition. You will see that the top 3 stressors on that list are death of a spouse, divorce, and separation. So a lot of stress comes from marital or work conflict. So to have less stress, as I've learned over the years, we have to keep a balance, and that balance would be your home, your work, and your environment. And there is in your textbook also the general adaptation syndrome, which is how the body reacts to stress. And it goes through some of the important points, which we'll be going to in a minute. So you might want to keep that in mind too. So how can we help a person who is really stressed? First of all, you have to take care of yourself and think about how you're feeling at the time before you're going to talk to somebody about their stress. See what you feel is your stress at the moment, if you have any. And as I say in the airlines, you put on your mask, your oxygen mask, before you help other people. So make sure that you're feeling centered and on balance. And remember that you can certainly be there and caring for this person, but remember, it is not your issue and you're there to help them. So you're with the patient, focus on the present. That is in the person's control. So, and that's what they need right now, is to grasp some control. And there's power in reflecting the person's comments, and they need to be heard and understood. Ask them, how can I help you right now? Or what would be useful and most helpful to you? And then you can give the person a few minutes to calm down if they're not ready to talk, and just tell them, look, it looks like you're struggling right now. Let's both of us take 3 deep breaths and then we'll talk. The nurse's role is to assess all the stressors and identify the healthy and the unhealthy coping mechanisms that the patient has, and identify, if you can, the signs and symptoms of their stress also. And that might take a while to identify after you've talked a while. Now, this pandemic has caused a lot of us more stress than we ever thought we would have, with everything going on and changing every day. So more people feel their stress right now and an inability to control their lives because of so many changes, and it's a whole different way of life. So if you're talking with a patient that cannot articulate what's going on with them, why he or she's been sent to the hospital, just, let that go, but let them know that you care about them and you want to be there for them. And then be sure to look in their record and find out what was going on with them the few weeks before they came to the hospital. And if nothing's there, try to talk with the family or a significant other. And of course, the care team in the hospital, because they may know the patient from other times of being in the hospital. Oh, also, before we leave this slide, it could be that the patient has not been compliant with their medications, and that they got stressed and with side effects. And sometimes when people are home, they do cheek their medications so that the family thinks they're taking the medicines, but they're not really. So that's another little note that you might want to check out, see about the medication regime at home. So our bodies are going into a fight, flight, or freeze. And let's get that up here. There is also in your book the general adaptation syndrome. And as I mentioned before, that's an acronym is GAS, G-A-S. So stress sends signals to the body to protect itself. And that's our survival mode. When there's a threat, it's detected by the brain, and especially the medulla oblongata, and it tells the body to increase blood flow to the heart, lungs, and muscles to allow the person to be prepared for the fight or flight. And you can see the details of this in that figure 5-2 in the book. But this is the alarm stage. So, like they're aware that something's happening. And that's when, you see animals, their ears are up and they're expecting something to happen. Then there's the resistance stage, and that's where the body tries to stabilize itself, and that they try to get back into the norm for their cardiovascular system and the neurotransmitters and the hormones, and hopefully all return to normal. And then the body feels like it's stabilized. But cortisol often is released during that time to give the muscles energy from the reserves that you have in your body. So, eventually you get restabilized. It could be in a few seconds, it could be hours, or it could be a long time. So, the exhaustion phase, this is where the body continues in the alarm state and feels like there's the threat still right there. And they aren't able to really adapt very well. This is when they freeze. They can't think. They're not able to really act to get themselves right in the right adaptive and role. And so the stressors are still prominent and the body can't adapt. So that's when there may be other forms of illness that manifest because the person hasn't adapted. And then if it's over a long period of time, it results in death. So we don't want that. But actually, there are people that have problems like hypertension, chronic fatigue syndrome, arthritis sometimes would be considered chronic stress result. And then of course anxiety disorders that could become chronic, and other disorders perhaps. But an example I thought of was a spouse who is abused or has a partner who's addicted to substances, alcohol or drugs, and their lives are really difficult all the time, but they don't leave that partner and they stay with that partner for years and years. And most likely this will develop into a chronic medical condition. It's interesting, though, I did read in the textbook, and maybe you saw this part too, that we have begun to learn about how stress makes us feel. And even in the lower grades in school, they're teaching young children about how they can cope and what options they have and how to problem solve. And they're learning about decision trees, where if you go this way, that'll happen, and this way, that's the consequence. So I'm very happy that that's happening, and that I think that'll help a lot of people. Okay, get rid of some of these things. So there are healthy defense mechanisms, and we'll go into the unhealthy ones at another time. But right now, humor, compartmentalization, exercise, healthy diet, yoga with breathing and relaxation exercises, cognitive behavioral therapy, mindfulness, meditation, guided imagery, progressive muscle relaxation exercises, And then, of course, take a mental health day whenever you can. And that always helps with reducing stress. If you can sleep really deeply and relax, that's great. That helps a lot too. In regard to humor, I don't know if you noticed in some of the backgrounds of our famous comics that many suffer from depression. And that seems to be kind of a common thread among the comics that we know about their backgrounds. And that's how they've coped, it sounds like, and they've done a really good job at it, and they make us happy when they're really funny. Of course, healthy diet and exercise, we know about that, and the yoga. And cognitive therapy helps the patient to recognize thought patterns that increase their stress and become more aware of self-talk, of what they're telling themselves, which increases their stress when they feel threatened about something. The guided imagery, I'm just going to tell a quick story here. I was on a vacation with my daughter, who was an adult at the time, and we decided to go river rafting up on the Snake River in Oregon, and it was on Memorial Day, at May 31st. And my daughter had never been river rafting, and so I thought she would enjoy it. And as we were going to the place where we were launching the rafts, it was snowing up in the higher levels. And it was pretty cold, but we got down to where the rafts were and got into the boats. And I chose this before this kind of trip because I had been river rafting before. And if anybody else has, you know that the rapids that you go down are put in categories of 4 or 5, which 1 to 5, but 4 and 5 are the toughest. And we had 4 to 5 level rapids. So we wore wetsuits, but there was nothing on our feet except our sneakers. So to get to the point, it was so cold, and I was not able to enjoy the ride due to the cold water, but I started to shiver, and on the way home, I couldn't stop shivering. And my daughter did guided imagery with me to help me calm down and to actually feel warm. And she made me imagine that I was on a beach with warm ocean waves and sand, and the sun was beating down on my head, and I was all warm, and that did the trick. And so it does work, and when I was a therapist, I used all of the above with the anxious patients, and they said it worked when they were in the office, but they could also relax better when they were home alone. So it's very healthy and helpful to have these kinds of defense and coping mechanisms. Okay, so stressful events. So this was in your textbook too. It's just how there is, if you're talking with someone, this particular woman was in the hospital for suicidal ideation, but the nurse would have to be aware of the risks for suicide first, but also to try to find out what were the traumatic events and whether or not, it didn't say this was for sure, but whether she was raped or if she had a horrible death-threatening illness, or if she had been a soldier in the war and was having some PTSD as well. So, this is something that you have to think about when you talk with your patients. So what is their stress? Okay, we're going to go into chapter 6, the neurobiology and mental health and mental disorders. And I've written out the objectives here. I hope that we can do that through this presentation. If I missed out on some important factor here, please let me know. I won't read all these, but you can go through them when you go ahead with this presentation. So the 1990s was the decade of the brain explosion. And we learned more through research over those years than any time before. And we learned what the role of the nurse is with people that have particular conditions or mental disorders. And the basic role is to understand the neurobiology, the physiology, and the genetics about your patient, if you can find out, and to know how the psychiatric patient is affected by their treatments, their tests, and medications, and that relationship that you have with the patient and how they are behaving. It could be from genetic issues or physiologic or neurologic. Okay. So the next slide is on the neuroanatomy. So we have the central nervous system, the CNS, where thoughts, perceptions, impulses, and actions begin at this place. We have the brain, that's the primary organ that actually controls how people interact with other people and how they see the world and how they interact with others. The neuron, 10% of the central nervous system is made up of neurons that conduct electrical signals. And then we have the synapses. This is where neurons connect to other neurons to interpret sensory information that they get. So all those things are very important as the neuroanatomy. We'll go next to the cerebrum. So the cerebrum is divided up into two parts and make up 70%. Neurons make up 70%. And the left hemisphere is dominant in 95% of the people, and it controls motor and sensory functions in the right side of the body. The right hemisphere controls functions in the left side of the body. So if a patient who has had a stroke and the left arm is paralyzed, but the actual blood clot or hemorrhage was in the left hemisphere and vice versa. You may come across that with some of your patients. So the cerebrum has 4 lobes or divisions: the frontal lobe and prefrontal cortex. So this is primarily a motor cortex. It controls voluntary muscle activity. Neurons in the cortex go directly to the peripheral nerves that innervate the muscles. So that makes everything move and you can be mobile. As the nerve tracts leave the brain, they form the pyramidal tract. And you will find out about extrapyramidal symptoms, or EPS. It can be a side effect of some psychiatric medications. The prefrontal cortex has to do with cognition, memory, and analytic functions. Damage to this area might cause changes in personality, which I've seen in people, changes in executive functions like being organized and being able to have pretty good sense of what you need to do every day, and reasoning and planning. So that's kind of an important spot. So this lobe takes in sensory perceptions. This is the parietal lobe, sorry. The parietal lobe takes in the sensory perceptions and its information in the environment, organizing all of that and communicating it to the brain. Damage to this area will affect the ability to follow directions, reading a clock, or dressing oneself. And when you do the mental status, it incorporates, at least the ones that I've done in the past, just, you know, like 10 or 15 questions. It incorporates the person's ability to draw a clock, and you give the person the time that you want them to draw. And often they can't do it. And it's very interesting to see. And the drawings would be put back in the record if you ever see that in the chart. So the mini mental status is important. Okay, let's go to continue with the lobes. The frontal lobe and the prefrontal cortex. Oh wait, we did that, sorry. Temporal lobe. The language, memory, and emotions are associated with this lobe. You may have heard of Wernicke's or seen that on the drawings in the book. The Wernicke's area is responsible for organizing words and represents emotional content. Damage to this lobe can be a result of a long-term alcohol use too. Now the occipital lobe, here's where we recognize colors, names of objects, and have the ability to track moving objects. So this lobe is responsible for seeing and receiving information through our eyes. And when the doctor does a physical exam, he wants to see if you can track his finger as it goes across your face. And probably you've read this or heard this, many years ago, it was common practice to treat the seriously mentally ill that they had very disturbing behaviors with frontal lobotomies. And fortunately, we don't do that anymore. The functions of the basal nuclei. Now, this is a collection of cells within the white matter of the cerebrum and the midbrain. It mediates movements and modulates muscle functioning so that it's coordinated. And the automatic behaviors that we just normally do, like eating, walking, or driving, are learned and programmed. So they're in our brains at a pretty early age, except for the driving. Conditions that have the basal ganglia or the nuclei if dysfunction are Huntington's chorea and Parkinson's disease, and some dementias. Sorry. Okay, let's go to the next. I'm sorry, I got distracted here. So the functions, oh, we did that. Oh, here we go. Okay, the functions of the basal nuclei. This is where if there's a dysfunction, there's no communication with the motor cortex. So these patients have a very distinct gait or movements of the body and extremities. I don't know if you've ever seen anyone with Huntington's chorea, but it's quite interesting because they are doing all kinds of gyrations And this is genetic, and there's no cure for it. But they can take Thorazine or Haldol as medications, and these medications do have side effects, but I don't know, they seem to be able to do better on those medications. The Haldol and Thorazine's not used very much at all anymore. Haldol is used, and it can have those extrapyramidal symptoms that I mentioned, EPS, and you might see that on the unit. If you do, you might want to check it out to see if that's a side effect of the medications they've been taking. The limbic system, and you can see this on table 6.2. In general, the limbic system does have to do with a person's instincts, primitive drives, fear, and sexual arousal. The amygdala is one of the structures that modulates emotional states and regulates affective response, such as anger, aggression, and love. And the possible theory that the misfiring of the amygdala may be the etiology of bipolar, because bipolar disordered people have very labile emotions. They can be crying, and then in 5 minutes they're angry. They're really in a full-blown manic state. Hypomania, you don't see that as much, but anyway, the hypothalamus is the structure that regulates sleep or rest patterns, thirst, and body temperature, as well as our physical drives of hunger and sex. And researchers are looking at the behaviors that occur in depression, the seasonal mood disorders, schizophrenia, and dementia, to see if they do have a dysfunction of the hypothalamus. You may see older adults with dementia that wear sweaters on a very, very hot summer day, and they're not hot at all. It has to do with their temperature here. And also people with affective disorders that may be out walking the street with a heavy overcoat on a hot summer day, and you think that's really weird, but they don't feel hot at all. The brain stem. There are two parts to the brain stem, the pons and the medulla. And the brain stem controls basic life functions we really need, respirations and heart rate. And of course, if there's trauma to that area, it's kind of like the person's going to be finished very soon. I think we'll take a break here, and we'll come back to the neurotransmitters in just a little while, and take a little break, and we'll come back to segment 2. Thank you. So we're back on segment 2, and we're going to talk now about neurotransmitters. So these guys are really important because they facilitate the transmission of chemical substances from one cell to the other. So they do have varying potentials of the neurotransmitters and reach the synapses. There's a change in permeability of the membrane and allows the neurotransmitter to substance to be released. The neurotransmitters are critical to neural communication and mental disorders that occur when there's a dysfunction. I'm going to go back one slide. And you'll see the electrical and chemical synapses here. This is in your book too. The neurons do have varying actions that they can perform when needed, and the action potentials are here. So they can detect, process, generate, and conduct electrical signals or currents. So what's the clinical significance of neurotransmitters? So because of so much research, our understanding of the function of the neurotransmitters has increased dramatically and will continue to increase, I'm sure, with the knowledge through research. And we'll find out more about the part they play in mental disorders. For depression, there are 2 major antidepressant classes of drugs that help this disorder. The tricyclic antidepressants, the selective serotonin reuptake inhibitors, they're called SSRIs for short, and the monoamine oxidase inhibitors, or MAO inhibitors for short, and the anxiety disorders, phobias, panic disorders. I don't know that Xanax is used that much anymore. I think other kinds of medications are more effective these days. But all of them are having to do with something in the neurotransmitters. Schizophrenia, the current treatment continues to focus on the elevated levels of dopamine. The most commonly used antipsychotics suppress the dopamine. Well, okay, we did that already. There are other studies that are interrelated to our body systems, and psychoimmunology, which is the study of the relationship between neurology and the endocrine system. Studies have shown that stress suppresses the immune system. Here's the neuroendocrinology. So it's a study of the nervous system and the immune and the endocrine system. And research is being done involving the hypothalamus and hormone regulation. Chronobiology is the study of biologic rhythms or interruption of the metabolic rate that we have, disruption of the sleep-wake cycle, and you've probably heard of circadian rhythms. When you go traveling to another time zone, how your body is kind of off kilter. It's not in the normal circadian rhythm for your time zone. And temperature. So these are all studies in this particular sector. The thing that I found interesting is that they have theorized that dreams are the result of electrical activity in the brain areas, and that it may be touching on the old memories and trying to recall them through dreams. Psychoactive drugs modify brain waves in the psychotic patients by temporarily restoring them back to normal circuits. And antidepressants increase brain waves and reduce the REM sleep, the rapid eye movement sleep. Sundowning is the exacerbation of the symptoms in the late afternoon and evening that patients have. They become, some, not everybody, does have confusion or increased agitation, and so this, medications can help that, but you might witness that when you're there on evenings in the psych unit. And there are treatments such as ECT or electroconvulsive therapy, and this kind of therapy is, they kind of have the person have a little seizure, and it suppresses abnormal brain wave patterns and then restores them back to normal. Another treatment that's is becoming more popular now is to treat depression and delaying the progression of dementia, and that is called transcranial magnetic stimulation, or TMS. Both of these have been successful in helping the treatment of depressed people who are resistant, or no matter what kind of treatment's been done before, they're still depressed. So this has helped, these treatments have helped them. The one thing about TMS is that it's not known to have any side effects, whereas the ECT has a side effect of causing memory loss. Now, stem cell technology, that's been in the news quite a while, and it's a stem cell is a complete genome that's intact and hasn't been developed into a specific type of cell yet. So the researchers are able to deliberately control the gene expression before the body does it on its own. Now, neuroplasticity, or the ability of the brain to change its structure and function, this is pretty interesting. The brain can repair itself, and I think that's pretty incredible. There's a lot of research being done on genetics to isolate certain genes that are related to a medical or a psychiatric condition. And I mentioned before about Huntington's, chorea, and Parkinson's disease as genetic related. And there may be one gene involved or many genes involved, particularly in conditions such as schizophrenia, attention deficit disorder, and antisocial behaviors. So what do? We have to find out what's going on in the brain. We have psychobiologic tools. Neurologic imaging has been developing since the 1980s. And we are learning more and more about the brain now, and actually are seeing through the imaging what the brain looks like inside from various positions. So we do have CT scans or computed tomography, the MRI or magnetic resonance imaging, the PET scan, PET, position emission tomography, SPECT, the photon emission computer tomography. So table 6.5, you really should look at that. It'll be your reference for nursing care for patients having these tests. And let's see here. So what is the nursing care? I'll give you a hint here. So if you, it probably will happen that you'll have a patient that's going to have a test, and if you can go with them, it would be good just to kind of see how they're prepared and how long it takes. Usually they're around 15 minutes or sometimes 30 minutes, but the patient really has to be prepared for these kinds of tests. So you should ask them about allergies. If the test uses iodine, the patient may have a GI upset or feels warm or be allergic to the iodine, like I was when I had a test for a kidney stone. And I never knew that I was allergic to iodine before, but I began to have the feeling that all my airways were closing up, and they had to give me IV medication, Benadryl, or I don't know what they gave me. It was a long time ago, but that was pretty scary. So make sure that you ask about allergies. Claustrophobia. People are going to be in a long tube, and they're more open now than they used to be. So make sure that the patient can be still the whole time, and find out how long it would take the test, so that the patient is informed about that. The patient has to be ready for these kinds of tests, especially someone with a mental disorder. So assess as best you can to see how ready they are. You know, they could go to the test and then get there and say, I can't do this. But anyway, you can try to find out as much as you can if they're ready. Definitely educate them on the reason for the tests and reassure them that these tests have been researched and all are found to be very safe. You have to know if they have pacemakers or metallic implants, if they think they're pregnant or they are pregnant, or breastfeeding. And here's a little interesting fact, is that the actual research for the CT scan started in 1972 and was funded by the Beatles of all groups. So good for them. For a PET scan, ask if they have taken tranquilizers, and if so, how recently, because the doctor should have a hold on the tranquilizers, because the medication interferes with glucose patterns in the cells, and so it's going to affect the results of the test, because they want to see where the glucose is going and what cells it's taken in by. So these tools measure, depending on the test, the oxygen levels, the glucose uptake, and the size of the ventricles. And there can be 2 or 3 different positions. So I would suggest that you do answer the questions at the end of both of these chapters. And on page 110, I thought there was an interesting little bit about some research on the quote unquote suicide brain. Very interesting. So to close now, I hope you have a better understanding of neurobiology, and it's so that you can better understand your patient and what they may be going through, what's happening in their brain, you know, if you see any testing, and how it affects, what effect all of their background, their neurobiology has on your patient's behavior. So with all of that, you can give better nursing care. All right. So thank you. And we will close chapter 6. Bye.